Hello and welcome back to the Therapeutics Chronicles. I'm your host Momen Wali, and today we are diving deep into a medication that's almost everywhere in clinical practice, Pantoprazole. Whether you are in hospital, a retail pharmacy, or working in long-term care, you have probably prescribed, dispensed, or even taken Pantoprazole at some point. It is effective, accessible, and generally safe when used correctly. But here is the thing, it is not always used correctly. And that's exactly why we are breaking it all down today. Before we get started, a quick note. If you are preparing for pharmacy board exams or just want to connect with a community of like-minded learners, check out our Telegram and WhatsApp study groups. The links are in the description, and I would love to see you there. Also, feel free to connect with me on LinkedIn. I'm always excited to continue the conversation beyond the broadcast. Alright, let's jump in. Pantoprazole is a proton pump inhibitor that suppresses gastric acid production by irreversibly inhibiting the hydrogen potassium ATPase enzyme in the gastric parietal cells. It is often chosen for its efficacy and relatively low potential for drug interactions compared to other PPIs. Here is a quick clinical gem. Pantoprazole is known for its flexibility in dosing because food does not significantly affect its absorption. This makes it a great option for patients who have irregular eating schedules. It is commonly prescribed for gastroesophageal reflux disease, including erosive esophagitis, and is also used in the management of peptic ulcer disease and in Zollinger-Ellison syndrome. Typically, it is recommended for short-term use, 4 to 8 weeks for GERD or peptic ulcers, but in conditions like Zollinger-Ellison syndrome, long-term use may be necessary. It is also used in combination with antibiotics for the eradication of Helicobacter pylori infections as part of triple therapy. One common mistake I see all the time is prescribing Pantoprazole without a clear indication, which leads to unnecessary long-term use. I have lost count of how many patients I have seen who have been on PPIs indefinitely without reassessment. And what does that mean? It means they are at increased risk of adverse effects without any real benefit. So, it is crucial to regularly re-evaluate the need for ongoing therapy. Speaking of adverse effects, Pantoprazole is generally well tolerated, but long-term use comes with risks. We are talking about things like bone fractures, vitamin B12 deficiency, hypomagnesemia, and even Clostridium difficile infections. This is why it is so important to use the lowest effective dose for the shortest duration necessary. I have had patients who were on Pantoprazole for years for GERD symptoms that were actually being triggered by their diet or lifestyle. After gradually tapering off the PPI and making some lifestyle changes, they did not even need the medication anymore. It's all about the right approach for the right patient. Let's get practical with some case scenarios. Imagine a 45-year-old male with chronic GERD who has been taking Pantoprazole 40 mg daily for over a year without reassessment. He comes in complaining of fatigue and tingling in his hands and feet. What is going on here? Well, prolonged PPI use can lead to vitamin B12 deficiency. So checking his levels and considering supplementation or tapering the PPI is essential, or even stopping it. Or consider this, a 60-year-old female with a history of peptic ulcers is prescribed Pantoprazole 40 mg twice daily. She stops taking it abruptly after her symptoms improve and experiences severe heartburn a few days later. This is a classic case of rebound acid hypersecretion. It is why patient education is so important. Explaining the need to taper the dose gradually over several weeks can make all the difference. And then there is drug interactions. While Pantoprazole generally has fewer interactions compared to other PPIs, it is not completely risk-free. For example, because it inhibits gastric acid secretion, it can affect the absorption of drugs that require an acidic environment, like ketoconazole or atazanavir. I once had a patient whose HIV treatment was not working effectively because Pantoprazole was interfering with atazanavir absorption. We had to adjust his regimen to get his viral load back under control. If you are working with patients on long-term Pantoprazole, do not forget to monitor for nutrient deficiencies, especially vitamin B12, calcium, and magnesium. This is particularly important for patients at risk for osteoporosis. Consider supplementation with calcium and vitamin D if necessary. Also, a quick but crucial tip. While pantoprazole can be taken without trigger to food, taking it 30 minutes before a meal maximizes its efficacy by ensuring proton pumps are active. Educating patients about this small adjustment can lead to much better symptom control. Alright, let's switch gears for a rapid-fire Q&A to wrap things up. What is the mechanism of action of pantoprazole? It irreversibly inhibits the proton pump in gastric parietal cells to suppress acid secretion. How should it be taken for maximum efficacy? Ideally, 30 minutes before a meal. What is the standard dose for GERD? 40 mg once daily for 4 to 8 weeks. What are the major risks of long-term use? Bone fractures, vitamin B12 deficiency, and hypomagnesemia. And here's a golden rule to remember. Always re-evaluate the need for long-term PPI therapy. Patients often get started on these medications and just stay on them without anyone ever checking if they still need them. This is a big opportunity for us as healthcare professionals to improve patient outcomes. And that's it for today. If you found this episode helpful, do not forget to subscribe and share it with your colleagues. And remember, if you are studying for board exams or just want to stay connected with other healthcare professionals, join our Telegram and WhatsApp study groups. Links are in the description. We have got a great community of learners helping each other out. I would also love to hear from you, whether it's feedback on this episode, questions about pantoprazole, or topics you would like me to cover in the future. And if you want to connect on LinkedIn, just search for Momen Wali. And always remember, medications are only as safe as the people who use them correctly. Catch mistakes before they catch you. Until next time, stay curious, keep learning, and keep making a difference in patient care. Take care.